Chapter 3 is not for the faint of heart. It talks about all the theories and therapies involved in mental health. It also, again, talks about the recovery model of care, which is not focused on a cure, but a focus on how to adapt to the environment and so forth. So I think what I need for you to focus on are the main theories of psychiatric care, like the psychoanalytic, that's Freud, he's Freud. Interpersonal, behavioral, cognitive, and the biological therapies. I think you need to look at, in particular, the nurse's role and how these theories influenced what we do as nurses. So it starts on page 27, the influences of theories and therapies on nursing care. So I do, want to make sure that we know as nurses what influenced the type of care that we give to patients. And there's a really good table on 28, table 3-6, and it's nursing theoretical works relevant to psychiatric nursing. And that's not, these are all nursing theorists. These are like, again, Imogene King, we've got Jean Watson, Hildegard Peplow, and all of those. So those are really, really good and important for us to know. Now, the type of therapies that are provided, there are various types like family therapy, group therapy, therapeutic milieu, which you will need to really know, throughout about therapeutic milieu and how you establish that or help to establish that as a nurse. Again, on page 30, it talks about the role of nurses in therapies and how we lead therapy sessions and who can lead these sessions. There are some sessions that trained registered nurses can lead, and then there are some that only advanced practice nurses can lead. Like psychotherapy, a general nurse, whether you've been trained extra in mental health, you will not be able to do psychotherapy unless you're an advanced practice nurse. Okay. Other than just reading this, I don't know how much more of highlights that I can give you. Look at your key points again to remember and applying the critical judgment. Look at all those things in your book, but we'll talk about these more if you have more questions. Okay.